One of the hardest things to do in healthcare is benchmark the performance of your patient engagement campaigns. Is the open rate of your reminder emails above or below average? Is your video completion rate where it should be? It's very difficult to know. That's why I was very excited to connect with Cynthia Church. She's the Chief Strategy Officer at Xealth, and they just announced the launch of their Dewey platform, which they created to solve this very challenge. Let's get to it. Cynthia, welcome back to the program.
It is great to be back on the program.
It's always great to see you. We have so much fun when we are in person. I wish we could be in person right now, but virtual will have to do.
Yeah, same. We did something wrong today, but here we are.
Now, you're on the program because I recently got something from you guys, from Xealth, that you recently announced the launch of Dewey. Can you tell me what that is?
Sure. Dewey is our use case categorization tool, but it's more than that. It's a benchmark. And first off, I say, what's a use case? That is a digital health program that's trying to get a patient to do something. So it's a population of patients, and you want them to read something, watch something, enroll in something, download something, and then in order to be able to achieve a clinical or operational goal. So that's your use case. And we wonder, so across different things, what are the different categories of use cases in digital health? And it's things like diabetes prevention, it's maternity, it's surgery preparation, it's behavioral health enrollment. And none of these things fit neatly into a sort of service line category or US news category. So at Xealth, we created our own, and we've said, well, we should be able to see, how do programs with similar objectives, like diabetes prevention programs, how do these DPP programs compare against each other from different health systems? So we've created a series of those. We've grouped our nearly 1,000 different use cases into these different categories so that we can accurately measure and provide some benchmarks, hopefully the first industry benchmarks based on real live actual data on how different things should be able to perform in the realm of patient engagement. For a long time, we've had, I want to launch this, but what should I expect? And we could anecdotally say, well, let's see, if we're doing, say, surgery preparation for a child, like preparing for your tonsillectomy has really, really high engagement. Preparing for your child's tonsillectomy, I should say, where something like managing your diet for CKD patients isn't as high. So we know this, but to what degree is there a difference? And what should you expect if you're trying to engage certain patient populations with certain conditions to do certain things?
And Cynthia, where does the data come from that goes into Dewey?
So the data for Dewey is really, it's, if you think about it through marketing terms, it's open rates, it's download rates, it's click-through rates. So we're keeping it really high level. It's not PHI based in that instance. It's more population based, and it comes from Xealth. It's, we are a digital health platform that enables distribution and measurement and monitoring, of course, of digital health programs. So as we send things out on behalf of health systems, then we can keep track of, say, if we sent you surgery instructions, did you click the email that sent them? Did you download the instructions? Did you respond better to one headline versus another headline? Was it better if you had to log into your patient portal versus if you didn't have to log in? So really that's what we're tracking, but we're not tracking what happens after that. Like that belongs to the health system and to, in some instances, third-party vendors, but predominantly the health system. We're the digital health deployment platform for nearly 30 of the nation's leading health systems. And together, we think one of the things that we do is facilitate a collaborative approach to really driving better performance for the industry as a whole. So our clients, they already work together. I mean, it's healthcare, everybody collaborates. But how can we give them meaningful data that they can use to collaborate? So, I'm getting a 60% open rate on my, my maternity program. Well, that feels weird. I'm getting 75% on mine. Well, are you making them, what exactly are you leading them to? And how can we learn from each other so that we can all achieve the best results?
So Cynthia, where can people go to learn more about Dewey?
They can go to our website, which is www.xealth.com.
Hey, I want to really thank Cynthia for coming on camera with me and talking about their Dewey platform. I really think Xealth's clients are going to get a lot from using it. It's going to allow the marketing departments and patient experience teams to be much more agile and much more efficient. They're going to know what is performing well and what isn't, and they can adjust their strategy to address that. And hey, if you enjoyed this interview as much as I enjoyed being part of it, please like and subscribe. Also, head on over to Swaay.Health, that's Sway with 2 A's, .health, where you can find more great content like this. I'm Colin Hung. Thanks for being here, and I'll catch you on the next episode.